In this video, we will review two techniques for a two-person transfer. In both techniques, one person will assume the leader role and the other will assume the assistant role. The leader will determine whether a patient may need additional help to safely transfer to and from the plinth. The leader will acquire a gait belt and seek additional help. They will brief the second person on the safety concerns or physical limitations, and they will advise on a plan to safely transfer the patient. The second person will assist and monitor for any additional safety concerns or hazards that may arise. The assistant will call out if safety concerns are observed. A brief screen to assess the need for additional assistance may include asking a few questions, such as how much help did you need to get in and out of the car today? Or did you get dizzy when you stand up? You may also ask the patient to perform various seated tasks for observing general strength. These movements might include kicking their legs out straight, marching their feet, and/or scooting forward and backward in the chair. If the patient has difficulty, the leader may decide they need assistance. At OOA, if you observe a patient sitting on a transfer sling of any kind, this person is not to be transferred as they require more support than we can safely offer them. Technique 1, one person on either side of the patient. Back in the room, the wheelchair will be positioned at a 30-degree angle from the surface that they will be transferring to. Wheelchair legs, the inside armrest, and any other physical obstacles will be removed to create a clutter-free path. The gait belt will be donned snugly, low at the patient's pelvis, not their waist. The patient will be briefed on the technique so they will feel more confident and be able to assist as much as they're capable of. One provider will position themselves on either side of the patient. Use the back hand to securely grab the gait belt. Use the front hand to steady the patient at their shoulder or secure their assisted device. Squat slightly down and brace through your abdomen to prepare to assist the patient to standing. The leader will count to 3. On 3, all parties will exert energy to achieve a standing position. Once standing, the patient will be given 1 to 2 seconds to ensure they are not dizzy or lightheaded. Once cleared, the leader will cue the patient one step at a time to guide them toward the new seat. We prefer the sequence walker, painful limb, not painful limb. Ensure the patient is fully rotated so that both legs are touching the new seat prior to guiding them into a controlled sitting motion. Then remove the gait belt. Technique 2, leader in front, assistant behind. If it is deemed the leader can assist the patient from the front, but would prefer an assistant to spot them, this technique may be best. Don the gait belt snugly, low at the patient's pelvis, not their waist. The patient will be briefed on the technique so that they will feel more confident and be able to assist as much as they're capable of. The leader will then position themselves in front of the patient. If the patient intends to use their arms, the leader must reach under their arms to the gait belt. If the patient will not be using their arms, the leader could also grab the gait belt from around the arms. The assistant will position themselves behind the wheelchair. Here they can either grab the gait belt or the patient's hips to help them stand or to help them feel steady. Squat slightly down and brace through your abdomen to prepare to assist the patient to standing. The leader will count to 3. On 3, the patient and leader will exert energy to achieve the standing position. The assistant will help to guide the patient's pelvis. Once standing, the patient will be given 1 to 2 seconds to ensure they are not dizzy or lightheaded. In this position, the leader will stay snug on the gait belt to assist the patient with balance. Once cleared, the leader will guide the pivot 1 step at a time to shimmy towards the new seat. The assistant will guide the patient's pelvis and monitor for safety hazards such as clutter, clothing being caught, or foot position. Ensure the patient is fully rotated so that both legs are touching the new seat prior to guiding them down a controlled sitting motion. Then remove the gait belt. Good screening, planning, communication, and body mechanics are the key to safe transfers. Employee and patient safety are our top priorities. If you are unsure, always err on the side of having more assistance available. If you have any questions, please speak with your lead.